Ladies and gentlemen, first I'd like to thank the teams. Ladies and gentlemen, my name is Xin Lin, English name Zhang Lin. I'm the president of Hualien慈济Hospital, Taiwan. And I also a professor of neurosurgery at the慈济University. I'm one of the inventors of this patent. And this clinical trial, phase 1 and 2A trial, involved 3 medical centers in Taiwan. The reason why we have conducted this clinical trial is that this is a unmet medical need for treatment of GBM, because currently recurrent GBMs only can survive 6 to 9 months. So we like to test these new drugs. Everybody knows many famous people died of the GBMs, including in USA and Taiwan. So 20 years ago, we started to develop this new drug called the Cerebraca Wafers. And after can finish almost 20 patients trial, we think this is maybe the first choice for surgical combinations currently. 30 years ago, for GBM treatment, at that time, we use a gradient wafer which contains 3.85 BCNU. But they can only extend the median overall survival by 6.4 months with the implantation of 8 wafers, gradient wafers. But the adverse effect of this drug involved in the delayed wound healing, and also may cause brain edema and epilepsy. So we start to develop this minimized side effect new drug. This also, we call this a Cerebraca Wafer, which contains 25% of the APIs EF001, which is a small molecular nature compound. And the implantation methods of this Cerebraca Wafer is similar to the gradient wafer. And now it says US FDA and the Taiwan FDA approved the 2A trial. And the target for this new drug is the receptor kinase inhibitor. The gradient wafer, which is the contains 3.85% BCNU, is a non-specific alkylating agent. In preclinical efficacy study, the gradient wafer has the extend the animal life 1.54. For the preclinical study of this Cerebraca Wafer new drug, extend the 3.64 versus Brink wafers. And the 6 wafer effects on this trial patients now currently is 15.1 months versus the Cerebraca Wafer 6.4 months, 8 wafers. And up to now, we did not see any adverse effect for this new Cerebraca Wafer implantation in the brain. And as I developed Cerebraca Wafer mainly caused the poor wound healing in 15%. The most advantage of this new drug contains, first, this Cerebraca Wafer drug can kill the cancer stem cells, GBM stem cells. Second, they can resensitize the TMG, tomato resistance tumor, so that this clinical trial is the combination of the tomato and after implant, this is Cerebraca Wafer. So they have the tomato synergistic effect. And the other important point is that Cerebraca Wafer can shut down the PDL1 expression in GBM cells, so they can help immune activation, so that the immunity of the patients to GBM can be improved. So this is the simple illustration of the Cerebraca Wafer target, which may bind to XL1 receptor, and so that they killed the GBM stem cells. They have the shutdown the MGMT activity, so they have the tomato resensitization, and has the synergistic effect with the TMG therapies. And they also suppress PDL1, so they have the immune activation ability. So this is the we published this fundamental molecular mechanism studies at this journal. And here, after introduce this BP, which is the API of the Cerebraca Wafer drug, so they can you see the MGMT can be shut down, so that they can resensitize the tomato resistance cancer cells, GBM cells. So it's in the dose-dependent type. In contrast, BCNU, although administered at the very high concentrations, this drug resistance GBM cell also have the high expression of the MGMT. Yeah. So this is the appearance of the Cerebraca Wafer, around 1.2 centimeter in diameter pieces of the drug. And after resection of tumor, we can implant on the resection surface of the GBM after GBM surgery. Here, the simple illustrations why they can synergistic effect on resensitize tomato to treat this recurrent tumor. Most of the recurrent tumor already has the TMG, tematol resistance, because they have the very high level MGMT expressions. For this new drug, after resection of the tumor, here, the recurrent tumor, they become they have the high expression of MGMT, and they become the tematol resistance. But if you do the resection of the recurrent tumor again and put in Cerebraca Wafer, this Cerebraca Wafer can resensitize, can shut down MGMT and resensitize this recurrent tumor to tematol. And also the Cerebraca Wafer also can kill the tumor cell, can kill the tumor stem cell, and this drug also can photosensitize if this tumor receive radiotherapy. So this is the protocol for we conducted the phase 1 trial, which is the the 3 cohort phase 1 trial. So the one piece of the Cerebraca Wafer in 3 patient cohort 1. If there's no side effect, then we move to cohort 2, 2 pieces of the Cerebraca Wafer, and then move to cohort 3, 4 pieces, and proceed to 6 pieces of the cohort 4. And now we finish this cohort 1 to 4 in 12 patients. Now we are using cohort 4, 6 pieces of wafers to treat more 10 patients to finish phase 2 trial. And the primary end point is the overall survival, and the secondary endpoint is the progression-free survivals. And the most important thing is to watch whether there's any adverse effect of this drug. So we include the patients with recurrent GBM, unilateral tumor in cerebrum, and they have the around 1 centimeter cavities where we put these Cerebraca Wafer drugs. The first question we ask is whether there's any neurotoxicity after implant intracranial Cerebraca Wafers. So, and the answer is no. So I'd like to illustrate this case. Mr. Wang, 85 years old, and 2020, he was diagnosed as the GBM grade 4, and he received surgery, radiotherapy, and tematol therapies. One more year later, the tumor recurred, and patient's neurological function worsened. So he was recruited for this phase 1 trial. So actually, this is the cohort 4 patients. We implant 6 Cerebraca Wafers into the resectioned tumor beds. So, and he was hospitalized in ICU 1 night. Second day, he was moved to the ordinary rooms. Here is the patient's recurrent tumor. After resection, we implant 6 Cerebraca Wafer pieces into the resection surface, and then we close the dura, bone, and wound. So this is before and after tumor resection. So
看当时，
当初伊
你住在倒？
光复糖厂。
So you can see the second day in the morning. So he can talk, can calculate, can walk, no motor and sensory deficit, which means second day means the drug concentration. Here on the second day, we routinely follow up the MRI, the CT, and MRI again to see how much tumor we resected and whether there's any operation complications. So this day, the patient at the time, the drug concentration in brain is very, very high, but the patient can speak and calculate, no personality change, have a very good cognitive function, and he can walk, can say, and so without any brain dysfunction. So this is follow-up 2 months, 4 months, 6 months, and now the patient still keeps very good conditions. So the summary is that we did not see any side effect in these patients after implant 6 Cerebraca wafers into their resection tumor beds. So and overall now in our clinical trial patients, we did not see any drug-related adverse effects or severe adverse effect, and we publish this paper here, and we can see if they compare this new drug Cerebraca wafer with video wafer, the survival at 6 months for low dose 1 piece, 2 piece, and 4 piece, the 6 months overall survival is 67%, while the video wafer only 58 pieces, 55.6%, and the overall 1 to 4, 75%. If we only calculate 6 pieces of the wafers, there's 100% survival at 6 months. So it's a very exciting result to us. And up to now, the median overall survival for low dose 1 to 4 Cerebraca wafers, the median survival is 12 months. And for 6 patients, Cerebraca wafer patients, now it's more than 19.5 months compared to 8 pieces of the video wafer. The median survival is 6.4 months. So the conclusion that low dose level of the Cerebraca wafer survival rate at 6 months was not inferior to video wafer in dosing 8 pieces. In subgroup analysis, median survival of the Cerebraca wafer treatment was superior to video wafers. In treating 6 species of Cerebraca wafers, median overall survival was improved by 1 year at least, with a median overall survival of 19.5 months, which is 3-4 higher than the video wafer. So the Cerebraca wafer versus video wafer is at least 3-4 overall survival more than the video wafers. Here the Cerebraca wafer for more than 6, the progression-free survival at 6 months is 100%, and for Temato, 22%, for Avastin, 44%, and for 6 months survival for Video Wafer only 6%, but Cerebraca Wafer 100%. So for the maxima, the high dose, 6 species dose, now the Cerebraca Wafer is more than 19.5 months, and the Video Wafer only 6.4 months. And this I'd like to talk more deeply about the downregulation of the MGMT expression by using Cerebraca Wafer. Also, Cerebraca Wafer inhibits the GBM stem cell growth. This is the case 1. Overall survival is more than 1 year. Low dose 1 wafer. This is the recurrent GBM cases pre-operation. Second day operation, the wafer coverage 25.9% of the surface of the resection bed. And this is 1 month, 2 months, and 3 months result. So it's stabilized the resection, the surgery results. So this patient overall survival 13 months, 86 years old. This patient is ITH wild type, Temato resistance, and because this patient's GBM cells contains 94% CT133 positive stem cells. Also, SOX2 positive cells include in this GBM cells is over 90%. The difference means the non GBM resistance, non Video Wafer resistance cases around 20%. SOX2 positive cells contain 5 to 10%, but in this case, more than 90%. And you can see the IC50 for our Cerebraca Wafer is around 420 micromole. For BCNU, it's more than 2,000 micromole. So means it's the did not respond to BCNU wafer. For Temato, the IC50 300 micromole. If you implant Cerebraca Wafer there, on the second day we start to ask patient to take Temato. So the synergistic effect can lower down the IC50, Temato IC50 down to 200. So we sensitize here the Temato MGMT expression in the placebo, in low dose, high dose. If you put 2 drugs together, the MGMT shut down completely, means which is not Temato resistance. So we here we also like to present one low dose 1 wafer cases. So this patient 1 year later recurred and include this trial, low dose 1 piece trial, and we analyze the IC50 for the patient's GBM cell culture, primary cell culture, including the stemness, the expression of PD-L1, and the expression of MGMT. Here the patient, after resection of the tumor, here resection of the tumor, and then here the follow-up. The second day after the day 3 after the surgery, and here it's very stable in 2 weeks. So these subjects show improved the KPS score, and they survive for a very extended times. And patients sample the primary GBM culture show the very high expression of the MGMT. And after the if we add the Cerebraca Wafer, we shut down the MGMT expression, means we sensitize the tumors to the tematol reuse. And they whether the Cerebraca Wafer can turn the correlation immune suppression lesion into heart activation lesion. This is the another case, progression-free 6 months, low dose, 2 wafers. This is the before surgery. After surgery, there's because this is a very important motor area, so we left around more than 50% of the tumor there, and then we implant the Cerebraca Wafer 5 months after the tumor shrinked. And this is the GBM stem cell, cancer stem cell. This patient primary cell culture contained 91 CD133 positive cell, almost 90%, over 90% of the SOX2 positive cell. And this is the BCNU IC50 tematol. IC50, if you put tematol with this Cerebraca Wafer together, they lower down the IC50s, and the here the PD-L1 shut down from 50% to 20% of the tumor cells, and the interferon GABA can elevate up to 140. So compared to BCNU, this Cerebraca Wafer inhibits abundant cancer stem cells, and combined of the low dose tematol, they can have the synergistic effect through the MGMT downregulation. The Cerebraca Wafer reduce PD-L1 expression and increase interferon GABA to turn correlation into hardenation. So this is why this nature compound, this is the this small molecule are very effective to killing the cancer cell among also the cancer stem cells. And here we like to show another cases 50 years old, is young here. The after recurrent, they have the huge involvement in patient's right brain. So he joined this trial, and we also confirmed they can have the tematol synergistic effect, have the immune activation effect, etc. Here, yeah, that's the patient. Yeah, the resection, we took 2 pieces of the drug into this huge.
叫什么名字？ 哦，不错不错，那我知道。
Okay, after
哦，这样子。
左手能不能动看看？
左手，你的左手举起来。
so there's no.
哇
So before surgery, he already had the left hemiparesis, but after surgery, he has the a very small improvement in his left hand movement. So this is the basic molecular study for these Cerebraca wafers, and we also like to to know whether this drug can spread into the tumor, residual tumors. Here, this is the case which was implanted 6 Cerebraca wafers on day 2, 2 months, 6 months, 12 months, 26 months. So the tumor disappeared, and the tumor stem cell contains 84% SOX2 positive, contains 80% of the cells, and they have a very remarkable tematosynergistic effect. Also, can shut down the PD-L1 expression. Also, elevate interferon gamma expression. So again, this new drug have several molecular mechanisms. They can synergistic with the temato. They can kill the cancer stem cell. They can shut down PD-L1 expression in cancer cell. They elevate the interferon gamma levels to activate patients' immunities. So here, 6 wafer, high dose patient, 66 years old, they have limb weakness, and wafer patient that limb weakness. So we implant the 6 wafers and discharge it soon. And here, so we analyze again IC50, PD-L1, interferon gamma with very confirmed again and again. Yeah. The second day, after the OPD, patient are very good. So 20 months, very good. So immediately after the surgery with implantation of the Cerebraca Wafer, they improved the KPS, and they progression-free extend over 26 months with 6 Cerebraca Wafer, and they can live by herself. So this is the unresectable GBM in the cervical cord. This is also a recurrent GBM, but the GBM is not in the brain. It's in the spinal cord. So we applied a compassionate trial, and we published this paper here. Yeah. So after here, the tumor, we did the limited resection for culture, for pathology, and 3 months after, the tumor regressed. 8 months disappeared. So this is the GBM spinal cord GBM patient. Also, Cerebraca Wafer was used and was very useful. And here, whether we needed to conduct more than 90% resections, so that to extend the patient's survival rate. And in our early phase 2A result, we said that we don't need to do the very extended resection of the tumor, because frequently this extensive resection of tumor may leave behind a very big neurological deficit, like hemiparesis, aphasia, coma, etc. So we only do a very careful tumor remove, a very limited tumor remove for diagnosis, for culture, for precision gene therapy, something like that, and we leave the tumor there so that we can keep patients' neurological function well. So here, we publish this idea at this journal. So I'd like to share with you this case. 43 years old, recurrent GBMs, and every outstanding neurosurgeons did not see any hope for this case. And here we did the surgery, limited resection of the tumors, and left lots of the tumors behind in the patient's blood brain. But you see, the second day pre-operation, second day, and 1 month after resection, 3 months, 6 months, 11 months, 1.5 months, 12 months, the tumor. This is the one resection. The another resection of the MRI. You see the tumor disappeared, and the brain volume shrink a little bit because the tumor disappeared. So here is the patient's 2 years after the tumor. He can say very good. He is the ophthalmologist doctors before surgery, because he suffered 3 times brain surgery, and we did the last. So after surgery, he can speak and keep his function well up to 2 more years. So he can very good cognitive function. He can teach patients about the eye care, and his wife and his daughter. So it's looks that this untreatable and resectable recurrent GBM can be treated. This Cerebraca Wafer, but this patient, because it's a compassionate trial, we also add some CIK immune cell combined therapies, so that the outcome with this patient is very, very good. The patients are still alive and can live alone, can also conduct the ophthalmic care teaching for patients. And we publish this the Cerebraca Wafer API. We call it the BP. BP is synthesized chemicals, but contains mainly in tangui. So we synthesize this BP, and the purity for BP is 99.99% for these patients' trial use. And this tangui has the NT, as here. This Chinese herb drug pure compound, so he can activate AMPK gene. We call this HAP gene, and this HAP gene keep the cell in the balanced state. If the cell move to cancer, like recurrent GBM, this HAP gene, MPK gene, can bring back these oncogenes back to normal. And this drug BP also can involve in the apoptotic cells, the dying gene, or they can activate the rejuvenation genes to bring back the dying cell into a normal cell. So now we are currently testing this drug in motor neuron disease, in Alzheimer's disease. So the nature compound, small molecular APIs like BP has the keep in yang balance, like the hub genes keep cell in the homeostatic state. Not if deviated to cancer cell, then it can cause it bring it back to make this cancer cell disappeared. And also, if this dying cell, the Alzheimer's disease, they can rejuvenate these cells into a normal state. So it has the anti-cancer effect, also has the anti-aging effect. So this is a characteristics of this nature compound, small drug. They can affect the hub genes, keep cell in a very homeostasis. So our conclusion is this: many subjects show excellent prognosis. Cerebraca Wafer is potentially one of the best choices for surgical combination to treat the GBM. Everfront Biotech Inc. is ready to finish this phase 1/2A study and quickly to initiate phase 2B/3 study planned via multi-center nations. Here, welcome you all to Taiwan, Hualien, which is located in the eastern Taiwan, and this medical centers was built by Master Zheng Yuan 36 years ago. This is a place now Master Zheng Yuan living just 10 kilometers away from the hospital. So we call this very 感恩 means we send to you all